Should I start video, Leslie?
Yes. Hello, everyone, and welcome. We're going to get started in just a couple minutes. While we're waiting, if you want to say hello in the chat box, let us know where you're joining us from. Again, hello, everyone. We're going to get started in just a couple minutes. We're saying hello in the chat box right now. Oh, I see folks from Oregon, California, Detroit, Alaska, New York, lots of California and Ohio. Good morning or good afternoon, depending on where you are. So we have a packed schedule, so I'm going to go ahead and get started as people are still coming into the room. This webinar is being recorded. A link to the recording and the slides will be shared on our website and email to you. As we're going along, feel free to interact with your fellow attendees in the chat box. But if you have questions for the panelists, please put those into the Q&A box so we can see them and read them aloud. We'll also have a couple of other opportunities for you to continue the conversation. We have a Padlet that we've set up as kind of like a message board. And then on Friday, we're going to be having open group office hours, so you can come and talk to some of our presenters again. Ask them any questions about you have about your program that you're planning. So with that, I'm going to turn things over to Aaron. Aaron?
Thank you, Leslie, and thank you everyone for making time and joining us for now day 2 of our Summer Planning Bootcamp, our Get Ready for Summer series. I'm Aaron Dworkin. I'm the CEO of the National Summer Learning Association. Again, and I just want to start by saying thank you to everyone who's making time to come, and thank you for the work you're doing to help young people in your communities and in your programs. It's going to make a huge difference, and it's more important this summer than almost any summer prior. And we're trying to get you all the resources and help you need to make your program amazing. So we're going to get into the day. Yesterday, just so people know, was day 1. We focused on the research around academic learning loss and highlighted some strategies and programs and free resources people could use to support students academically. Today, we're going to get into the issues around COVID safety. And we're going to hear from great, wonderful presenters, and then talk about how can we promote health and enrichment and health and fitness in our summer programs. We'll hear from practitioners as well. I just want to also highlight that our today's sessions are the title presenter is NCASE, the National Center on After School and Summer Enrichment. And you'll hear from Katari Coleman representing NCASE in a minute, and along with the American Camp Association and Alliance for Healthier Generation. Thank you to them for being great partners and leaders and co-presenters of today's sessions. If we go to the next slide real fast. So people, hopefully you know what NSLA is, but if not, just know that we've been around for more than 25 years. We're focused on combating summer learning loss, now COVID learning loss, and have a vision that wants to ensure that every young person in America, regardless of background and zip code, can afford and access a high quality summer learning experience every single year of their lives. And that's something we're all here doing, providing those opportunities, and we just want to make sure everyone gets them. Next slide. So again, I'm not going to go too far into this. We're all here. This is a doers meeting. This is not a philosophical meeting about why summer matters. I think we all know summers make a huge difference. And if anyone asks, you have some research here to back up these points, but we believe very strongly what I call our 4 I's, that summer is a unique time for improvement, both for young people and for the adults. It's a time to be innovative. We recently put out a call for innovative summer programs, and we had a huge response in a couple of weeks. People have so many good ideas that they want to test out and try out over the summer. It's a time to break down silos and a time to build partnerships in a way where people can actually do them and model them. And so we'll see so many of those partnerships coming this summer. And then it's a time for impact, both at the individual personal level of a young person, but also for our country. And we have a chance now, there's real discussion of putting billions of dollars more into after school and summer programs and community partnerships, where we can make this not just a nice to have, but a need to have that everyone prioritizes in this country. Next slide. So I just want to bring to your attention tomorrow, piggybacking on what I just said, we're having a bonus session at 3 p.m. to 4 p.m. East Coast time with Senator Chris Murphy from Connecticut and Senator Michael Bennett from Colorado, talking about how the federal government should invest more in summer learning and out of school time and after school programs and partnerships. So we hope you will join us. We'll put that link out. It's a welcome invitation for everyone in our community. Next slide. And these are resources. These were some resources. Every day we want people who are taking time to come and join us, not only to hear from our great presenters, but to walk away with tangible resources you can use, you and your staff can use as you plan for this coming summer. So these were some of the great resources that we lifted up yesterday, and you're gonna get more so you can access these. And then today we have some others that you'll be able to check out as well from our partner NCASE, from research from Wallace Foundation, Alliance for Healthier Generation, the field guide and other resources you'll hear about from ACA, and actually our friends at the Georgia State After School Network, who work really hard to create a turnkey activity guide for their programs, making that available to everyone across the country. So these are just some, but again, nobody has to start from scratch, nobody has to reinvent the wheel, and no one has to feel like they're alone. We're all in the same boat, all trying to help millions of kids, giving them great experiences. Next slide. I just want to lift up a few things. Again, we're talking a lot this week, but the conversations don't end and the support doesn't end. One of the ways we continue to do that is through our professional summer learning communities around specific topics. Each one is facilitated by an NSLA field consultant. So you can learn more about this on our website, but if you have a very specific niche kind of topic area or setting you're working within, you might want to work with peers in similar situations. So we hope these can help you. Next slide. And then of course, like ACA and Alliance and so many other groups, we have training opportunities and resources to help you on lots of different topics. And so again, Friday we'll have office hours for people who want to have smaller and intimate conversations. But if you want more intensive training, there's a lot from our partners, from us around lots of topics, and we're happy to help you. Thanks. And then we have a few other big events coming up that we'll invite everyone to join us. Our National Summer Learning Week, July 12th to 16th, a real public awareness and advocacy week, so people know the important work you're all doing. And then we have a national conference where hopefully we might be able to join together in person. We will see. But if not, it's just another way for us to connect and share the latest and best practices in our field. Next slide. I would now like to just turn it over to Katari Coleman from NCASE to share a few words about her role and and their resources they have for everyone. Katari.
Thank you, thank you. I'm so happy to be here today as part of the NSLA Bootcamp series here as a representative of NCASE. That's the National Center on After School and Summer Enrichment. Next slide, please. So I just want to really just go over what we do. Basically, we're part of a national training and technical assistance system funded by the Administration for Children and Family, the Child Care and Development Fund, or better known as CCDF. And this network of national centers supports states, territories, and tribes in implementing CDF to provide low-income families who are working or participating in education with help for paying for childcare. Therefore, we support and explore issues related to the OST field, including summer. And NSLA is our partner on this. Next slide, please. And just to provide some relevancy here, we want to quickly show you our school age data profiles. This is a look at the most recent national data profile developed by NCASE that shows that school age children served through subsidies make up about 44% of all CCDF subsidies. given the need for school-age care since the pandemic, this may have increased in this fiscal year. And this is inclusive of summer programming. And next slide, please. And so really with regards to the topic of the day of health and safety, COVID safety, we wanted to share some information that we know is relevant right now. And due to the impact of the pandemic, we know that facilities that are open must contend with guidance from multiple factions. So that's like your local health officials, school districts, et cetera. And they do this to determine the most appropriate plan and action for the facility. Some of the general expectations are noted here, like social distancing, strategies for groups, modify health screening procedures, temperature checks, mask wearing, that have unfortunately put an extra burden on operating programs, but increases the safety and protection of children in care. Next slide, please. So given the information that we shared, we referenced all of our health and safety issue from the CDC, but we do have other resources and information that can be helpful to everyone in out of school time, including those of you with regards to summer programming, summer learning and enrichment that you can access in our resource library. Next slide, please. And if you ever have any questions regarding the services of NCASE and our work, you can contact us here at ncase@ecetta.info. And once again, I want to say we enjoy being a partner with NSLA.
Well, thank you, Katari, and thank you, NCASE. And I just want to make sure everyone in our community knows about the great resources that they're providing to all of us. And now I'll just say one line. I'm going to throw it over to our moderator and our panelists. But prior to being at NSLA, I used to be the president of the national network of a group called After School All Stars. And we had a line that said, our vision, what we want for all children in that organization were the same things we all want for our own children in our lives: to be safe and healthy, graduate high school and college, find a job they love, and like all of you on this call, be in a position where they could give back to others. But all of that starts with people being safe and healthy. And during COVID, the leaders, all of us, have had to adapt. And the folks that took the biggest leadership role, in my opinion, in helping not just our entire field, but our country figure out how to run safe programs for young people were our friends at the American Camp Association, led by Tom Rosenberg. And we're very honored that he is here today to moderate a panel on lessons learned and strategies and recommendations they have for all of us. I'll give it to you, Tom.
Okay, thanks, Aaron. Hi, everybody. We're so glad to be with you today to talk about best practices for operating summer programs in as safe and healthy a way as possible during COVID-19. I want to move right into introducing the panel so we can get to it and get to questions and answers and things like that. While we're presenting, please feel free to put your questions in the Q&A area of the Zoom webinar, and we will try to answer some of those questions online, and we'll pick some of them for live answering. So my name is Tom Rosenberg. I'm the president and CEO of the American Camp Association, based in Atlanta, Georgia, and our association is based in Indiana. I'd like to introduce to you our panelists, or I'd like them to introduce themselves. So let's start with Dr. Laura Blaisdell. Laura.
Thank you, Tom. My name is Laura Blaisdell. I'm a pediatrician with a background in infectious disease research and policy for my master's in public health. I, in addition to being a camp mom, am also the camp medical director at the camp that my husband is the owner director of, and have served as the camp medical director there for the last 20 years. So I was able to help this past summer as we opened during the time of COVID, and look forward to sharing some of those insights with you today. Thank you, Tom.
Thanks, Laura. How about you, Shannon Steele, one of our program experts? Shannon?
Thank you. My name is Shannon Steele, and I am from the YMCA of the Triangle in Raleigh, North Carolina. And I'm hoping to share learnings that we've experienced working through the pandemic when we opened up camp at the end of March, and we've been running it ever since and changed multiple ways.
Was that March of 2020, Shannon?
That was March of 2020. So we're coming on our 1-year anniversary.
Awesome. Our next program expert is Jessie Avens. Jessie, could you introduce yourself, please?
Hello, everyone. My name is Jessie Emmons. I'm the Director of Youth Development and Innovation at Frost Valley YMCA. We are in Claryville, New York, which is in the Catskill Mountains. We, being very close to New York City, closed down pretty quickly due to COVID last year and the impact it had on our area, but we quickly pivoted starting in the summer of 2020 to run day camp programs and open up a virtual learning program. So we have been running since June of 2020 and haven't stopped. And so I'm here to share what we've learned and what we're planning for 2021.
Thanks so much, Jessie. And let's now hear from Dr. Lori Brown, our Director of Research. Lori?
Hi, everybody. My name is Lori Brown, the Director of Research for the American Camp Association. Like Tom said, we are based out of Indiana. I am physically based in Salt Lake City, Utah. And here in Utah, I was a day camp director, the first accredited day camp. I got our day camp accredited for the first day camp in Salt Lake. That made no sense whatsoever. That's because I no longer do that and I do research, which I'm excited to talk to you about. And I'll turn it back to Tom.
Thanks so much, Lori. So so camps, a number of camps operated last summer. About 18% of overnight camps and maybe 60% of day camps operated last summer. So I think what we want to share with you today is what we learned from 2020 and also from this year through a number of different research studies. And so what do we know and what do we not know about from summer of 2020? And so I'm going to go ahead and start back with you, Lori, to just sort of give an overview of the studies that we did and the big themes that came out of those studies, please. Next slide.
Absolutely. So we conducted a suite of studies starting as early as March, recognizing that we're in an unprecedented time and had an opportunity to learn a lot about a lot of different aspects of camp. Much of what we're going to talk about today is rooted in a study called Camp Counts 2020. And this is where we collected data on COVID cases, COVID practices, and the impact of COVID on camp operations and enrollment. We'll be referencing this report throughout the presentation. I'll also drop a link to where you can access this report in the chat box. It's free and available for everyone. But I'd like you to know too that we conducted studies, a qualitative study with camps to better understand their decision-making processes, how they navigated the season of trying to make decisions when very little information was available, because there's a lot that can be learned there. And then we also conducted studies with youth, with staff, and with parents. And so a lot of that is woven into the reports that we'll be sharing with you. But across that suite of studies, there are really three big themes. We're going to use those themes to organize our discussion with our amazing panel today. One of those themes is that decision-making was really, really difficult. This should come as no surprise. I don't know that it's gotten any easier, but we did learn some things about what made for successful or effective decision-making. So we're going to be asking our panelists a little bit about their decision-making process in early March, and then what we can glean from that as we head into 2021. The second big theme was around what we call non-pharmaceutical interventions, NPIs, or basically all the things that we did in our programs to screen for, prevent, and mitigate the spread of COVID-19. And we learned quite a bit about that. And we'll be talking about that as well with our panelists. And then the third big theme was around engaging staff and parents. And we had some insight from parents about what they perceived as most effective and what they saw in camps to help engender trust in sending their children to camp. So we're going to be asking our panelists about what they learned about engaging with parents and with staff, because staff played a really vital role, and we don't think that role is going to be any less as we head into 2021. Before we turn it over to the panel, I just want to share a couple of tidbits from our Camp Counts report. And Dr. Blaisdell is going to go into much greater depth. So this is a bit of a spoiler alert, but I think this is a really important point or a place to start our time together today. Can we go to the next slide, please? Thank you. So in our study of, we collected data from almost 1,400 camps this summer, and then really narrowed that sample down to about 486 camps that ran in-person programs in 2020, and asked them to report COVID cases. And the bottom line is that COVID cases were very low in 2020. We collected data on about 74 reported cases or confirmed cases, 10 of which were at overnight camps, 52 were at day camps. And this is about, a total, if we include staff in that, 102 total cases of about 90,000 participants served. This is great news. We're really excited about this. We're also very aware at the amount of media kind of visibility that was given to outbreaks. And so even though our numbers show that COVID cases were quite low, we are very aware that perception of COVID in summer programs and camps was quite high. And that's something that we're facing this summer. So we are eager to share these data and eager to share what we learned about what resulted in low COVID cases. This, by the way, is in that Camp Counts report that I just referenced. So we'll make sure you have access to this. Let's go to the next slide, please. What we know worked, and again, Dr. Blaisdell is going to go into much greater depth about non-pharmaceutical interventions, is what we're going to eventually call a Swiss cheese approach to protection. And that is that we use multiple layers of protection, from screening to shelter in place, to daily screening, to cohorting, to masking, to cleaning, to altering our activities, and then testing. We'll be talking about all of those. But what we saw is that for the most part, non-pharmaceutical interventions were very highly used at camps, and there was a relation between adherence to NPIs and low COVID cases. In particular, and let's go to the next slide here, masking. Masking really rose to the surface as quite possibly the most potent of the NPIs. This does not mean that we recommend this above and beyond or in place of any of the other NPIs that we're going to discuss today, but this does elevate the importance of masking among campers and staff. There was a direct relation between consistent adherence to mask wearing and low COVID cases. We also have an epidemiological report that shares these findings. So if you want to dig into the research of this, I will drop the link to that report in the chat as well. So Tom, I'm going to kick it back to you, and then I think you're going to turn it over to Laura.
Yes, I am. So thank you so much. So in terms of, let's see, so kicking it over to you, Laura, to say a bit more about what we learned.
Absolutely. If we can just go to the next slide.
There we are.
So, and I think there's another click and there should be an image that comes up. So one of the other, so the camp that I, as the medical director for, opened last year, and we were able to put these diligent multi-layered NPIs into place. I was also the camp director, or the camp medical director during 2009. I think we all remember swine 09, H1N1. So we were able to also use these layers then effectively as well. I was able to share the experience of 4 summer camps in Maine in late August in MMWR. It looked at over 1,000 individuals that came from multiple states and international locations, in which we were able to stop SARS-CoV-2 infections at the door, and then those that came through the door, because we cannot promise a COVID-free environment 100%. We needed to work to prevent the transmission of it within the camps, which we did successfully. So I can help drop that in the chat when we get there. Next slide, please. So the general principles that Lori had there for NPIs are pre-camp behaviors, testing, traveling safely to camp, eating and sleeping cohorts, masking, distancing, maximal outdoor programming, hygiene, early identification of cases, isolation and quarantine, doing good contact tracing, and I'm so excited to be able to add vaccination again, although it's not a non-pharmaceutical intervention. And as Lori said, it is the layering of all of these together that provides the strength. So people often will say, what's the one thing that I can do? I bet we can test our way out of it, right? We can test our way into certainty. And the answer is unfortunately no. We need to continue to use these diligent multi-layers in order to do that sort of true strength and prevention of transmission in the summer camp setting. However, next slide, I do have a couple favorites. So being a public health and epidemiologic nerd, so one thing is pre-camp behaviors, right? So we have, we often will call this quarantine in the vernacular. It means something quite different to those of us in EPI. But instead of saying quarantine to families, like please quarantine prior to coming to camp, I like to use low risk behaviors and talk to families about what low risk behaviors are. Low risk behaviors are those that we can do masked, distanced, and ideally outdoors. They're also ones that we don't do in large groups, and we only remain masked, unmasked, and undistanced from our own family. So really important to be clear about those sort of pre-camp behaviors, because if SARS-CoV-2 is a meteor and we have an atmosphere around our camps, our atmosphere is made up of one of the biggest things that can be done is changing our pre-camp behaviors prior to coming to camp. Next slide, please. Okay, so the other NPI that I think is really cool, and because is the use of pods, cohorts, or families, which whatever the term is that you're going to call that in your program, they're the base unit of maskless activities, right? So these maskless activities are sleeping, eating, and a lot of things that have to do with water, right? They're showering or swimming. We cannot wear a mask while we do these things. So because we can't, we need to develop families in which we're going to do the maskless activities. These cohorts act as firewalls. If we can use the big three, distancing, masking, and outdoor ventilation, when families are in proximity of one another, we can have a firewall between transmission between families. And this allows, from an operational standpoint, allows you to continue your camp program while we're monitoring and managing the health and well-being of one family, but it also helps prevent massive transmission within the camp setting. The ideal size is going to depend on your camp and the consequences of having a large family size. And I think it's important to think about having two people between two families never meet the definition of prolonged contact. And that also has a nerdy definition of being less than 6 feet, greater than 15 minutes with or without a mask. So your public health officials will often ask if you have an outbreak, and I'm sure Shannon and Jesse, you've experienced this, who was next to that person less than 6 feet, greater than 15 minutes, and we have to identify them as being at a potential risk. I also think it's important to think about bathrooms in terms of if you have a residential or overnight program, you might consider staggering the use of bathrooms by families. Next slide. I'm going to take a moment and just dive into testing, and I'm not going to go too deep, but just to frame how we use COVID testing. So we use testing diagnostically when somebody has symptoms, right? And we want to make sure that they have COVID or they don't have COVID. We do it for screening. So we want to screen all campers before they come into camp. We do it for mitigation. So if somebody had a prolonged exposure to somebody who was COVID positive, we might test those who were exposed. And then there's surveillance testing, and that we're starting to hear a lot more about in the school systems. We're starting to hear people say, okay, we're going to test teachers every week. We're going to test students every week. So that's surveillance testing. So each of these testing scenarios has a different test that's the best test for that scenario, right? We have 3 basic types of tests. So those are the molecular tests. That's the PCR. We've all heard about that. Great test. Takes some time to come back, but it is the gold standard of both diagnostic screening and mitigation. And then we have these rapid tests, right? They're antigen tests. They're called rapid antigen tests. And those are kind of like if you've ever brought your kid into the pediatrician for strep throat, they'll do that rapid test right there and tell you that result. But they also do a culture because that rapid test can be incorrect some percentage of the time. And so that's how antigen tests are working right now with PCR tests. So if we use an antigen test, it's great because we can get the answer back right away. But we usually tend to follow up those tests with that PCR. So next slide. So when can we consider testing, right? I get asked a lot, Laura, do we have to test? It's expensive. It's not in our wheelhouse. We have to make another contract. Can we just throw it all to the wind and not test? And the answer is yes, there were camps that did not use testing last year, but I think it's important to look at that context of where camping was last year, where testing wasn't ubiquitously available and kids were mostly sheltering in place prior to coming to camp, right? They just didn't have the same amount of exposures unless you were at Shannon's program, and she can talk to you about that. So for the most part, kids were doing very, very low risk behaviors throughout the spring. This year, we're seeing the prevalence of COVID in children being factors higher. Sometimes, in the last 2 months, we've seen factors of 10 higher than it was last spring. And thank goodness children don't tend to be horribly sick with the disease, but that does mean I think we'll have a few more meteors hitting our atmosphere this year than we did last year. So I do encourage you to think about some sort of testing program and think about how that might be possible for your programs. So we have those pre-tests, right? We can think about testing people prior to coming. And the risks are that to that test validity are what people do after they're tested. If I, Laura Blaisdell, I'm going to camp in 5 days, got my test today, and tomorrow I'm going to a wedding, test isn't going to be so valid on day 1 of camp, right? So we have to protect that test validity with those pre-camp behaviors. Most of those testing arrangements, the PCR that I'm talking about, and I do this because most of us have had one by now, and it's usually a nasal test. But you arrange those through primary care providers. You can do a local lab, or you can do a mail-in service. You want to get those tests as close to camp as possible, but you want to balance that with how long it takes for the result to come back, right? It's really helpful to actually have the test result prior to a camp beginning. Then I'm going to go on to the on-site tests. So if you decide to do on-site testing for your camp, it's important to consider having one of those relationships with a mail-in service or a local lab service. We usually do those tests 5 days after kids arrive to our camps because of the false negatives that can occur right after the exposures of travel. You really want to, if you're using testing as part of your camp process, you really want to just assume everybody's positive on day 1 and use those strict multi-layers of the NPIs prior to getting that test result back. And there is an increasing role of rapid testing, those rapid antigen testings. Although rapid antigen tests, I'll just have to tell you, are like saying, people say, Dr. Blaisdell, do you like rapid antigen testing? I say, yeah, I like cars. I like cars that run and work and actually are good. Rapid antigen tests come in many forms, and because of how tests have come to the market during COVID, the variety of potential tests out there and their validity can be varied. Mr. Tom.
Dr. Blaisdell, can you just, one of the questions that's coming in on the wire is, do you have a recommended strategy for testing protocols for day programs or day camps?
Day programs, thank you. That's a great question. So day programs to me are more akin to testing protocols that would be appropriate for schools, right? Because in that day program, you have people coming into your program and going home to a home environment at night. So unlike a overnight or residential camp who may be searching for purity in their bubble, right? They're searching to kind of control their bubble. Day camps have this in and out, right? All the time. So perhaps more of a surveillance program would be more appropriate for a day camp, or 2 or 3 times a week using an antigen program. So that next bullet down there, that's surveillance. And this is what I would talk about for day camps, right? So there's no gold standard for surveillance. That's why you see everything from the NBA renting out Disney World and testing everybody every day to schools opening with no testing surveillance whatsoever. So there's really no gold standard. And the factors that you want to consider are, what are your community rates and how much migration do you have in and out of your camp? In the day camp program, you have a lot of migration, right? So you might decide to do a testing strategy there. You can do 25% of your students or your campers every 2 weeks. You can do 10% weekly. You can do all weekly. You can do anybody who comes in and out. All of these things are acceptable options. And so you'll probably want to involve somebody who has a little bit more experience with developing a surveillance testing program that would be appropriate for your camp. Does not all have to be those PCRs. You could use, we're now starting to see rapid antigen tests used in this setting.
Thanks.
Yeah, next slide. I think I'm almost done. I think I'm just going to turn to talk about vaccines for a couple of slides here, and what role vaccines could have in camping, right? So the US federally available number of vaccine doses continues to be an enigma, right? Every state is waiting every week to find out how many doses that they'll have. The US federal recommendations for rollout of the vaccines did include teachers, childcare workers as part of their higher tier to be focused on. And fortunately or unfortunately, depending on the state that you're in, states have the ultimate decision-making process. So that's why you see states like mine in Maine, teachers and school workers not called out specifically to have the vaccine, or states like California where teachers are being put in those earlier stages. Despite that, we believe that the US public will generally have access to vaccines in April 2021. That is what Dr. Fauci says. And I'm wearing my Dr. Fauci socks today. So whatever Dr. Fauci says, it goes with me. Teens are faring much better than younger children in terms of their our thought process on how soon they'll have access to the vaccine. Both Moderna and Pfizer have filled out their recruitment studies to age 12. So hopefully by the summertime, we will have access to vaccines for age 12 and higher. Pfizer is currently approved for the use down to age 16. Moderna is at 18. And we have the AstraZeneca trials starting in children 6 to 17, and J&J FDA submission on page 34, if you happen to read it, does talk about the hints at using J&J in younger trials, even into infants soon, because they've used their modality in other infant vaccines. So what does this mean for camp? I think next slide. Oh, before we go into camp, one question I get asked a lot is, can we mandate vaccination for our campers or our staff? Generally, it's a state-by-state decision. There's this added issue of these vaccines have hopped through every single hoop a vaccine has to go through to be approved by the FDA. The only thing that the FDA said was, let's not do all of the red tape paperwork because we're in the middle of a pandemic. Let's actually put these vaccines out sooner through an emergency use authorization. We'll do the red tape paperwork later. So that's what an emergency use authorization was, and that's how vaccines came out through that emergency use authorization. The issue typically is that we don't have vaccines that are given to millions of people that come out via this method. It's only because we're in the pandemic that they chose this method. And typically we don't mandate things that are under this sort of EUA approval process. So I think right now, and I've worked on many state mandates for vaccines for school entry, but I think right now we're in an equitable access issue. The EUA is still looking at long-term effects and safety in populations that weren't included in the trials, right? So we have some special populations that we need to evaluate. And so at this point, some legal and ethical rulings have said that people can mandate vaccines. I'm strongly encouraging everybody who has access to a vaccine to get one if they're going to be in a setting like ours this summer, but perhaps we can't mandate it this year.
And one last question that came in, Dr. Blaisdell, about testing. Do you have any recommendations for organizations who are doing rapid surveillance testing for day camps?
In terms of, did you read that in terms of kind of frequency of testing or types of tests? Or?
Yeah, I didn't not specify, but yeah, I mean, would you go the route of antigen and just do pooling, or would you do everyone, or?
Yeah. So first of all, clarify, I don't own any stock in any tests. So I have no My only goal is for safety in terms of these tests. So there are kind of two methods. So the antigen tests are continuing to be individual. They're the ones that come back really rapidly. And people tend to use those like a couple of times a week if you're going to use the antigen tests. The pool testing is the PCR test, that molecular test. And people are, you're seeing pool testing, it's my week to be pool tested. And I think that is another option. Of course, you need to factor in, like I said, the transmission rates in your community. What are the migration in and out of your day camp? Are people doing high risk behaviors, et cetera? But I do think you might want to look at kind of multiple rapid antigen tests or thinking about pool testing because it's just much more cost effective in that setting.
Great. Thanks, Dr. Blaisdell.
Sure.
So go ahead. Sorry.
One last slide, and then I'll be done.
Okay.
I didn't make it in, I don't think. Okay. So I guess I'll just say my ultimate question was, what does vaccination mean for camp this summer? So the fact that vaccination is so effective in preventing hospitalization and death from COVID is terrific. Last summer, I was very worried about my staff, Shannon, Jesse. I'm sure you were worried about yours as well and continue to be. And so what vaccination this summer means is that my high-risk staff won't have those severe complications. But because of, I mentioned the childhood studies, because the childhood studies mean that kids won't have access to vaccine for the most part this summer, we're not going to reach community immunity or herd immunity rates in the populations that we serve probably till late this year, maybe early next year. So this is why we have to continue to use diligent multi-layer non-pharmaceutical interventions, at least until we can get those community rates in the populations that we serve up. So it's great, but vaccination isn't going to change what I do in my programs or what I'm recommending that people do in theirs either. With that, I will be quiet and let other people share their experiences. Thank you, Tom.
No, thank you, Dr. Blaisdell. So let's shift over to talking about camp operations during 2020 and what we learned from that. So Jesse and Shannon, let's talk to the two of you. Could you maybe each take a whack at the question of what were the primary factors that shaped your decision to open your programs last summer? I know a lot of folks in the audience are trying to decide whether to open or how to open. And how did you adapt your program? What kinds of pivots did you make? And what kind of advice might you have for these providers who are out in our audience today who are currently navigating the decision-making process for camp? Feel free to jump right in.
Sure. So like I mentioned before, we're located about 90 miles outside of New York City. So we were right in the middle of the hotspot last spring. And so everything closed down here pretty quickly. And then what we learned a few months into it, while we were still kind of in this like scary, we don't know what's going on mode, they closed down overnight camps, but then said day camps could run. And ultimately our decision to open came down to, could we do it safely? And it's the right thing to do. And so ultimately it was, could we do it safely? And so the answer was that took some time to figure that out, and what program adjustments we would need to make. And then lastly, it was, if we can do it safely, then it's the right thing to do. Our kids needed camp. We needed camp. We just needed to be doing what we do, which is to serve kids and families. Program pivots that we made, we went into a pod model. So we had kids, they were in pods. They did not intermingle with other pods. And if they did, they wore masks. We had staff that didn't shift from pod to pod unless absolutely necessary. We asked all of our staff to have a negative COVID test before coming to work with us, and then asking them just to do, like, be smart, low risk activities, don't go to concerts, don't go to bars or indoor dining. And then we just integrated a lot of hand washing and a lot of sanitizing, which is mostly what I did, which was just walk around with sanitizer bottles. And then we shifted our schedules. We had assigned bathroom breaks. We had all of our program areas were pre-assigned before kids went to them. And we got a lot of buy-in with our families as well. And we'll talk about that with parent engagement, but they wanted camp to run so badly that when we were like, we need you to please be safe, because if something happens, this ruins it for everyone. They bought into that, and they were good. And I will say that our summer, making the decision to run was the best decision we made. Camp was one of the best summers we've ever had here. It was my favorite summer. It was very intentional and very just incredibly impactful, and everyone gained so much from it that I couldn't recommend opening more.
Thank you, Jesse. That's awesome. Shannon?
Yes, thank you. So we started running the last week of March in 2020, and that's really fast. And when we started running, we were only running for essential workers. We're surrounded by a lot of main hospitals and first responders. And so our first call was our mission that we serve all. And these were people who were forced to go to work. So we needed to provide childcare for those kids. It was also extremely scary because we had just laid off. So I come in the beginning of the pandemic, my youth department was 10 staff. Now we're 4. So we had cut staff significantly, and we did not know going into running camp, how do we do this? Is it safe? And so we had to look a lot at what the CDC was saying and what our Department of Health was saying. So we did not require tests. We still do not, but we do a health screening and a temperature check between every time someone comes in, whether it's a camper or if it's a staff member. And we have done that since day one. And we actually even do that in our main facilities for our members to come in. They have to do a temperature check. So we just kind of went from turning off the water fountains, you have to bring a water bottle, no sharing of equipment, the pods, tag games turned into tags with a pool noodle, that's 6 feet. So we just got really creative, went through a lot of Ziploc bags, backing individual marker packs for kids. And from a staff perspective, we pulled everybody's skill set and just who's good at what, let's divide and conquer. And I don't think I've sanitized anything as much in my life as I have this past summer, because we didn't stop running after Camp Hope. We went into day camp to the greater public. Same rules, 6 feet. How can we fit people in here on a rainy day at a safe distance? That was the biggest thing for decision making, because you look at your camp space and you're like, oh, I can fit 250 kids at camp. Well, not if it's a rainy day, everyone's inside and 6 feet apart. So that was a big thing. And then school started. So now we're a learning center. So we have changed the game in ways that, I didn't want to be a teacher growing up, but, here I am.
Thanks, Shannon. As Lori was mentioning early on in the conversation, I can imagine that parents were nervous about sending their kids to your programs last summer. And could you just comment on how well the non-pharmaceutical interventions or those layers of protection work in your program, and how challenging or hard it might have been for your staff to do them, or was it relatively easy once they got trained and used to it? And then finally, do you have any suggestions for the folks in the audience about communication strategies when you're about helping parents be more confident with our ability to offer programs safely in the summer like you did last year?
Sure. So I can't recommend the non-pharmaceutical interventions enough. We also do daily health checks. We still continue them here. There's a paper form that parents have to fill out, and then temperature checks are happening. We do just like forehead temps, and if those are elevated from the non-touch, we also have oral to back it up, because those are more reliable. But the non-pharmaceutical interventions, at first, I think staff seemed really overwhelmed. I mean, we as directors were also overwhelmed, but once they get into the groove of what's expected, they actually are really great about it. I think we were really nervous about kids in masks and whether or not they would be able to handle it. And honestly, kids are very good with masks. They're great at it. They're better than most adults, actually. I think one thing I would recommend is that you are providing time or space, or just keeping in your brain about giving your staff some of those mask breaks. Kids get to have mask breaks just because they are in their pod or they're doing their running games or doing those things. But your staff also need them, especially if you're outside and hiking and doing things on hot days. Like, it's important for your staff to get a moment to go and like take it off and breathe. Yeah, and so non-pharmaceuticals, I can't recommend them enough. We did not test anyone. We still don't test anyone. We just ask for that one test before they come in. But otherwise, we aren't testing, and things have been, touch wood, been going really wonderful. And then parents, it's just, we, more than anything, we shared our New York State Department of Health guidelines. We shared CDC guidelines. We were more transparent than we've ever been. And that's just because things were changing so fast, and things still are changing so fast, that we had to tell them, this is what we know now, and this is what we're doing now. But this might change, and please know that we will bring you along with us as they change. And yeah, we just had a lot of, I think I had more pre-camp conversations and more, I think I still now have more conversations about what we're doing and how we're handling situations. But it's just us being honest and really intentional, but it's also helping us really build stronger relationships with our families, which is really, really wonderful.
Shannon?
All right, sorry. I agree. I think we got really lucky with kids. Kids are so resilient, and I think that we saw that right off the gate when kids were wearing masks and everyone was so concerned, but it was really the teenagers and the adults that didn't want to wear the masks. And that's where the sticking point was, but it was the mask breaks, and the kids want to be there. They want to, and if I have to wear a mask but still see my friend, I'm in for it. And the parents who are signing up for camp also want that for their kids. So that's working in your favor, that these parents want it. But the first thing you're going to need is patience to talk to these parents, because they are scared, they don't know, and some of them haven't left their house in a year. Some of them haven't left their, they've only been with their neighbor across the street. And so the transparency is key. I will say that now we are a year into the pandemic. My conversations with parents are not as long, and they're not as often, because people are figuring it out. Some of them are going to school, and the ones that are going to sign up for camp want their kids. And if they're coming to you, they trust you, and just leveraging that relationship has been key for us.
Thanks, Shannon. Lori Brown, what did we learn from the Camp Count study in regards to parent perceptions and staff perceptions about can we do this?
Yeah, we learned quite a bit from parents. I don't think it's surprising, but what really rises to the top is that parents appreciated being engaged as team members. In situations where they felt like they were out of the loop or just at the whim of constantly changing information, they expressed frustration and lack of trust. But when asked about effective communication strategies, parents said frequent communication and honest communication. Parents are there as team members, but they wanted to be enlisted as team members in the process, and not just kind of responding to programmatic changes. We also heard that parents, we asked which of the NPIs they thought were most important to them, and they all rose to the top. And this is not necessarily an NPI, but one of the top scoring items was frequent and effective communication.
Nice. That's fantastic. Thanks so much, Lori. So just back to you, Jesse and Shannon, really quickly, can each of you maybe say one thing, one big takeaway that you're planning to do differently or really emphasize in 2021 in this coming summer from all the things that you've learned? Hard question.
I think the biggest thing is just to remember to breathe, be kind to yourself, especially if you didn't open in 2020. And to remember that what we're doing is so important, and our kids really do need summer programs more than ever, and need good, school age experiences more than ever. And just, have honest conversations with your families, have honest conversations with your departments of health. Those are all really important. And if you don't have relationships with departments of health or medical professionals, start building them, because they will be your biggest champions.
Thanks, Jesse. Shannon?
Mine would be to remember that we're all living in this pandemic together. So we all have the same questions. We're just not all really good at asking them in a calm and caring way. And everybody is an exposed nerve, is what I like to say. And so how is that trickling down to the kids? And so when we are honest and we're transparent, that's going to carry you. And also modeling. I'm not going to ask my staff to go and sanitize 50 pool noodles if I'm not going to do it myself. And also that's a break for them, being exhausted and just boots on the ground. We're all in it together and we're all an exposed nerve.
That's great. Thanks, Shannon. I think right now we probably just have a few more minutes. So let's cut away some questions that have been asked of us. So if the whole panel wants to come on. Let's see, the first question here is, are there resources specific to games and team building that encourage social distancing? I love the tag with the pool noodle game. Jesse or Shannon or anyone?
We honestly just made them up. So if we were used to playing tag from the very beginning, we were like, well, we have these pool noodles in the back. So a lot of things like that, just looking at the games you've used to play and adding, well, how can I do it safely, was kind of those were the questions we would ask ourselves.
Thanks. So for maybe this is for you, Dr. Blaisdell, as more and more staff get vaccinated, do you think daily health checks and masks will still be needed for day camps this summer?
So, I think I would answer that in an academic way and then in a practical way. So the academic way is that the science of gathering safely, or how we gather safely in terms of infectious disease, has to do with personal immunity and community immunity, right? So I am personally vaccinated because I have a lower risk of disease. But in many of the vaccines that we've enjoyed the benefits of over the last 50 years, those vaccines are like the COVID vaccine, in which we still can transmit the disease, even though we've been vaccinated and have personal immunity. So it is that concept that is so important, is community or herd immunity, right? That is what allows us to gather safely. That is what allows us to fly on planes, go on buses, go to summer camp, go to school. So it is that community immunity rate that is going to help us get to the point of dialing back all of these other interventions that we're using in lieu of community immunity to protect transmission and spread. Until we get there, as a country, as a world, as an individual community or camp, we need to continue to use all of our diligent NPI layers. Once we get to community immunity rates that are 70, 80, 90%, that's when we're going to be talking about pulling back these layers. And that's why you hear public health experts saying, hey, just because you got the vaccine doesn't mean we can just give up, right? So really important question. So don't do anything. I wouldn't do anything different in my summer camp. I'm not hearing much difference from Shannon or Jesse either. So let's keep it up one more summer, and we'll hopefully by 2022, we will be at those community immunity rates that will allow us to gather safely without all of these bells and whistles.
Thanks. So with that, Dr. Blaisdell or Jesse or Shannon, for example, one of the questions is, what are your recommendations for day camps to do if a child or staff member shows signs or symptoms or tests positive?
Are you guys going to dodge and weave? Let me. So I answered that in one of the questions and answers. So I think camps can take a variety of ways depending on their day, whether they're day camp, whether they're short-term overnight sessions, or whether they're long-term overnight sessions. You can have symptoms, go home until they're confirmed to be negative, and then you come back, like schools, right? You can have those kids go home, and if they're positive, then the pod that they were with at the day camp needs to go home and quarantine. And I see Jesse nodding, so maybe that's what you guys have done. And then if you're a residential longer, and I would recommend something similar probably for shorter term overnight camps. And if you're residential overnight but longer, you might have the opportunity to do isolation and quarantine for positive cases and symptoms within your camp. But remember that both of those right now are 10 to 14 days. So it's very difficult to do that if you're a camp that doesn't have a program that lasts longer than that time. So a couple of different options for camps to do.
Thanks, Dr. Blaisdell. So Mary from Selma asked a great question. In Selma, many parents are afraid to get the vaccine or afraid for their children. Schools are still closed. We want to supply a day camp for middle schoolers. How do you suggest we approach the parents to send their kids? And I was wondering, Jesse or Shannon or any of the panelists, what advice do you have for this day camp operator or program operator?
I think my first recommendation is to try to hold some kind of, whether it's a virtual town hall or some kind of survey, ask your parents. We are not the experts in what parents, like what families want. And so I think my very first recommendation would be to ask them and figure out what the best way to do that is. Because you might find that maybe it's not the right time to open it, but you might also find that there are a lot of people that do want that program, but I would ask them first.
Thanks.
I just wanted to add that what Jesse and Shannon and a lot of us have done is we provided the solution for how to open safely. And I think when parents see the solution, they see what we put into place, right? You guys, all of the plans and all of the effort that we put in to make sure their kids are safe. I think there's a relaxation. Shannon, sorry, I saw you come off mute.
Yeah. I was going to say that the town hall is great, and we just put it out front to parents that we've been working with the state health department. Our guidelines are from the CDC and the state guidelines, and that gives a little bit of trust. And also you might start really, really small, but then they're going to tell their friends it's safe and their friends it's safe. And so you just have to also be prepared for a very slow build of a camp.
Great. Thank you. So I think we're just about out of time, but we had one. Did someone answer that? You did answer that question. Virtual camps are definitely still happening. Someone's asking that question. There are a lot of children and teens who are not able, they're medically vulnerable or not able to attend camp. So a lot of camps did offer virtual camp programs, and a lot of camps are going to be doing that again this summer. And we have some great resources for virtual camps on the ACA website. I've posted in the chat the web address to the American Camp Association COVID-19 Resource Center. Please visit that website. There's lots and lots of free resources there, all for the taking. Particularly want you to pay attention to the field guide, which has been in development for about a year now and updated many times as a granular resource to a lot of the questions that you asked today. And I would like to also, Aaron has asked me just to let you know that the whole out of school time field, so camps, after school, summer learning programs, all of us have worked together to advocate for priority vaccination for staff, for workers in the out of school time field. So all of you and all the people that work for you to run those activities. As Dr. Blaisdell mentioned, the states control the last mile of vaccination distribution. So every state has slight variations on where education workers, out of school time, childcare workers, where they line up. But I can tell you that the CDC has included out of school time workers, childcare workers in essential worker, frontline essential worker priority categories. So in many states, we're seeing them be considered just right there alongside their teacher colleagues. So we have lots of resources for you. We hope you'll make use of them, and we'd love to be more as helpful as possible. All of the camp directors that operate a lot of summer are eager to help all of you that are just going to get into summer programming this year. So I think with that, I'm going to hand it back over to Aaron in case I forgot something. Oh, and yes, on the slides, if we could pop that back up one last time, please, whoever has the deck. Leslie, could you go back to the slides there where there's a free membership opportunity. So there are some of the links for you, the field guide, our resource center, all the research that Lori and Laura were mentioning, and upcoming trainings that are, many of them are free or next to free. The next slide. We have this amazing professional community for summer learning professionals, for camp directors and others. There's a coupon link at the bottom for free one-year membership. Doesn't cost a thing. So join us, and we hope to see you at some of our upcoming events. And I think that might be the last slide. Yep, that's the last one. So now back to you, Aaron.
Wow. Oh, wow, wow. All I can say is wow. And thank you. Thank you to Tom. Thank you to Laura, Lori, Jesse, Shannon. I think I'm speaking for many people who can't speak on this big Zoom call, that this was extremely inspirational and informative, practical, useful, and timely, that everyone needs this information and your ideas and your expertise and experience that you shared with us. I also found it inspirational that you're so collaborative and sharing and being humble about what didn't work and what did work, and taking and being leaders and having taken that step forward last summer when a lot of people for various reasons weren't in a position to do so. And so you kind of jumped in and you're being reflective and sharing with all of us. And anyway, your leadership is setting so many more of us up for success for this year and this coming summer. So I just thank you and echo all those resources will be shared and made available. And again, this conversation could have gone on for many more hours, but I hope everyone benefited from this, and we have, you know, where to go if you would like to talk more and learn more. So we all know, you know, we say safety first in our world. We can't do anything unless we're taking care of the safe and the emotional needs of our students. And so we're going to pivot here and talk about, now that we know what it takes to run a safe program, how do we make these programs as wonderful as possible that students want to come to? And so yesterday we talked about some of the academic interventions we could be pushing for. And today we're going to talk more about some of the health and fitness and enrichment opportunities we can provide, which really are designed to meet the holistic needs and all the interests of our young people that we're serving. Before we do that, I'm going to turn the panel over to Becky, our Medavanian, who is one of our NSLA field consultants, who's the director of the Lifetime Sports Program in Ohio, a nationally acclaimed award-winning program. But I think we have a video from students because, again, we're all adults, but we're here to talk about young people, and we always want to take a minute to remember that the young people are at the center of everything we're doing, and we should ask them for their leadership. And here, from Carlos Santini, who we're going to hear from After School All-Stars on the next panel, are some voices from students and their experiences during COVID. Carlos, Leslie.
You first started virtual learning. What did that feel like?
To be honest, it was pretty weird. It's like there's some technical issues. Like there's always technical issues with computers.
And I learned better face to face instead of online. And when I switched, it was kind of weird because not many of my friends were there, and we had to wear masks, keep our distance. And
what role did All-Star staff play in keeping you connected?
Our coaches are really creative because we can't play as much games because, you know, COVID, we have to keep our distance. So we played freeze tag, but instead of using our hands, we use pool noodles instead. They find different ways to keep this active in a safe way, you know, during this pandemic.
What action do you want the board to take after hearing from you?
I honestly don't know because I like All Stars just the way it is.
I think that'd be good would be having like more events with like more celebrity guests, and like because like everyone's interested if someone's a celebrity, and like using connections to like get more partners in All Stars.
Stay positive throughout what's going on right now because it's a lot going on. So, and it's a lot on their mind. I know it's a lot. Black Lives Matter, we do matter, and everybody just needs to unite and make sure that everything is going on right, correctly in this country, and we just need to stick together.
Great. Well, thank you. Thank you to hear from those wonderful All-Star students. Again, that's cool. This is why we're doing all of this work and putting in this time. And now I'm going to turn it over to Becky, who I've introduced already, and is our facilitator for our health and fitness professional learning community. So for anyone who wants to keep talking and working with Becky, she'll be available. But Becky, I'll turn it to you and our wonderful panel we have with you today.
Thank you, Erin. And first, I want to thank the panelists earlier today too, Tom and everyone. It was such, I mean, I know our programs here in Ohio operated under COVID last summer, and just having you guys be able to raise the voice of programs across the country is just an amazing feat, and to hear, you know, like stories coming from all across the country. We're hoping with this panel to really spend some time looking at how health and fitness and sport-based programs operated under COVID-19, what kind of plans are moving forward this summer, and how we can help kids have a healthy physical summer, as well as a mentally well and safe summer, as many of our kids are moving into school for the first time, or hopefully moving into summer programs for the first time as we return. So I'm going to introduce our panelists, and then I'm going to give them each a little bit of time to share about their individual programs or organizations and kind of where they fall in the sport and health and fitness space, to share, you know, both what they did last summer and what they're planning to do this summer. So I'm going to start with Daniel Hatcher from the Alliance for a Healthier Generation.
Thanks, Becky. It's good to be with you all today. Again, Daniel Hatcher, I'm the Director of Community Partnerships at Healthier Generation. This month is actually my 13th year at Healthier Generation. So I really love the organization and happy that I get to partner with so many folks like you all on the phone. As an organization, we've been around for 15 years, and we're driven by our passion to ensure that every mind, every body, and every young person is healthy and ready to succeed. So you might know us from workshops or our professional development and trainings focused on supporting children's physical and social emotional health. And again, I'm just proud to be here today with such good partners. Erin mentioned earlier that this boot camp is about resources. So I'll paste a link to our new Healthy at Home, Cole's Healthy at Home resource hub in the chat, which is focused on engaging and supporting caregivers. And last year, actually, NSLA was one of our signature partners for the summer campaign of Healthy at Home called #SummerSwap. So really grateful again to be here and excited to chat with you all.
Thanks for joining us, Daniel. And Katie, I'm going to pass to you.
Thank you. Hi, everyone. So great to be here with you all and just talking more about resources for summer today. My name is Katie Corda, and I'm the Director of Program Development at Girls on the Run International. Girls on the Run is an organization with a mission to inspire girls to be joyful, healthy, and confident using an experience-based curriculum, which creatively integrates running. So we're a national nonprofit. We work in all 50 states. In a typical pre-COVID year, we serve about 200,000 girls annually. We serve girls in 3rd through 8th grade. And, you know, we do that through our intentional curriculum and through our trained volunteer coaches, just to kind of give you a scope of our organization. And so hopefully we'll have some helpful insights for you all to learn from our mistakes and kind of our learnings along the way as we pivoted in this last year within the pandemic. Yeah, so just excited to be here, and that's a little bit about what we are and who we are and what we do. So I'll hand it back to you, Becky.
Thank you, Katie. And now, last but certainly not least, Carlos from After School All Stars.
Hey, Becky, it's good to see you. And it's great to be in company of Girls on the Run and Alliance for a Healthier Generation, both awesome organizations. I've been Daniel and I have been, I don't know, we've been on this road show together. You know, he just finished doing a self-care series for our frontline staff over the last couple of weeks. And so it's been awesome to see that blue wall, that blue bricked wall. I've been seeing that for a while. But no, my name is Carlos Santini. I'm the Executive Vice President of Programs for After School All Stars. We are a national organization that provides after-school programs for middle school youth primarily. We do offer both high school and elementary, but the middle priority of our programming is around the middle school age group. We are in 19 cities across the country with a comprehensive focus on both STEM, career exploration, academic readiness, the visual performing arts, and health and wellness, which are some of the strategies we will share about today. Our mission at the end of the day is to help our young people really have success in school and in life through this kind of comprehensive approach to programs. And so what we hope to offer today is really the lessons learned as we pivoted to virtual, as you saw some of our kids share. What did health and fitness look like? Obviously, we are not exclusively a health and fitness organization, but that's where our roots come from. After 28 years of doing this work with after school officers myself, I've been with the org 19 years. It's been interesting to see how we've come back full circle, right? We went comprehensive, but when the pandemic shutdown took place, we went back to our roots, which is really around the health and fitness of our young people, and by extension, our families and communities. So we hope to share some of that experience today. So thanks for having me.
Thank you, Carlos. So I think my first question for you all, and I know we're going to have questions coming in the Q&A too, so I might kind of throw those out as we go here. So those of you listening, feel free to ask a question. We'll try to weave those in as we go. But my first question is what was your pivot last summer? You know, many of us had to quickly pivot and be ready for summer. And what parts of that are you thinking you will continue on as you move into this summer? And what parts are you adapting based on where we know COVID is today in your communities? And anyone of you can jump in at whoever wants to go first.
I can jump in. It feels like going back in time a long time, but it's just 1 year. So where were we this time or going into last summer? So we had, at that point, like a lot of other organizations, we had quickly developed how to do our organization safely at home. So Girls on the Run at home. And, you know, those were grown up and girl lessons and activities, videos for the girl to follow along and move by herself. So that was one lesson that we learned right off the bat is families then, and I would say now, are still really in terms of their workplace and still being able to be at home or do extracurriculars with their kid. They're at really different places. And so as much as you can make programming flexible or kid friendly so that the kid could just pick it up and do it, whether it's social emotional learning or physical activity, we learned rather quickly that we wanted to make something that was on an interface or a user device such as YouTube that kids knew how to maneuver and access. And two, that was simple enough for them to complete on their own without the help of a grown-up. The second thing that we did last summer was we quickly did what we called a test and go pilot of a fluid program. So we quickly piloted this idea of a hybrid model because we knew that we didn't know what was going to happen next. We didn't know about school and site closures. So we wanted to create something that was as flexible as possible for our councils. So we basically created a program that they could start the first couple of weeks in person. And then if the school closed or the site closed, they could just seamlessly go to virtual. And so that was our work last summer, was really creating this program and trying to get it up and running for the fall. And we had a couple of great learnings that we're hopeful to, you know, see the impact of this summer. And number one of those learnings was be open-minded about what you think of as physical activity. So we are a running program, and so typically that, you know, that culminated in an in-person large gathering 5K, and that is just not COVID friendly. And so we really expanded for ourselves. How do we want to get girls moving, and how do we want to do it in a way that's, one, engaging enough for them to do on their own, right? That they want to keep going after a virtual practice ends. And two, that's inclusive and equitable, right? Given that people might not all have the same equipment at home, that there might not be a lot of space to move given where the girl's zooming in from or programming. And so with this second iteration of our hybrid program, we were able to create different ways for kids to move. We used like QR codes to get workout jams. We created a movement bank. So just some different things to kind of spice up what physical activity looks like when you're kind of sheltered in place or at home, kind of stuck. And we also really simplified our programming. So what you can do in person or your traditional program might not be what happens this summer, and it might not be you know, what happens whether it's virtual or in person, but if you can nail down your key tenets, what are the key things that make your program what it is, and how can you sustain them given the different you know, different physical safety guidelines or different restrictions, I think that's what we really learned. So really coming back to connection and team building, like if it's virtual, if it's hybrid, that's a key part of what we do. So we're going to keep doing that. And we're going to keep focused on that. And physical activity doesn't have to be running. We're going to keep focused on that. If they're moving more, that's a win, you know? So I think, you know, those two things, making it easy, accessible, and also coming back to what matters. So hopefully there's some learnings in there.
Yeah, I love, Katie, that idea of physical activity doesn't have to be what we've always thought of, right? And like, how do we get creative with kids and meet them where they are at in their home life or in their community? I think even in our program, we were really thinking through that about how we met our kids where they were. And rethought for us, we were very team-based oriented, team sport oriented. So we really had to think about like, what were those key tenets of a team program? Carlos, I wanted to kind of pose that question to you all. I know I got to interact very regularly with After School All-Stars here locally in Columbus. They're a great organization. And really hear more about how you all pivoted and what you're kind of thinking moving forward this summer.
Yeah, no, thank you for that. And a lot of good stuff, Katarina, you know, a lot of good stuff. Thank you for sharing that experience. I think for us, I would bucket our experience in three parts. Number one was the local pivot. So executive directors in these 19 cities all have their own cultural component to their communities. So we had to, at that point, EDs really looked at their communities and their culture, and they said, what do we need to create? What do we need to do? And one of the common elements across all 19 cities was this concept of the wellness check. We didn't really know what wellness checks were at that point until we realized, all right, families are home, we've lost our captive audience, we need to call them and see how they're doing. That initial first step around wellness, which is, how are you? That was new, and that was a lot more complex than we had imagined. And so that conversation was, how are you feeling? What can All-Stars do to keep you engaged? What are your needs? Before we started designing, we had that conversation. And so, you know, later on, we'll talk a little bit about what we learned in the wellness check experience and the partnerships that we created to perfect that process. But for us, it was the wellness check realization and exploration. What is that and how to do it well? And in that wellness check, nutrition was a big part of it. Food insecurity was a big part of it. And that data led us to start building a campaign around food distribution, which many of my colleagues here, both on the panel and in the audience, probably pivoted to. So, you know, that was one of the very first steps. Secondly, and I think, Katarina, you said it, our staff members became the celebrities, meaning they were creating YouTube channels, students were following them. And it was cool to see that that's how students stay connected. Not only did I see that with our staff, with our students, but I saw that with my own kids. Interestingly enough, the gym teacher was the most popular staff member when schools retreated to virtual. It was Mr. Alex, for my daughters, was the key person. He would play music at the beginning of every morning. They would do stretches. And so that initial start and the popularity of the gym teacher or coach was very evident in some of our cities. So staff became the celebrities. And then thirdly, one of the first things we did is we looked to our partners and we realized that we were not alone. And we know that in our industry, nonprofit sector, it's easy to fall into a silo, right? It's easy to go through the year and really fight the good fight and forget that you have colleagues and friends around you. And so we made calls. And one of the first calls was to Common Threads, which, as some of you know, National Nutrition Education Organization for Youth. And we looked to them to help us create a program that not only provides nutrition education for kids, but also meal preparation for families. So that could be an element of just dealing with the pandemic crisis, to cook together and make meals together. So Common Threads was a great partner in designing those pieces for us. So those are a few of the things that I can remember that we pivoted to rather quickly. There are others, but you know, I'll just share that for now.
I love that question. Like, how are you? Like starting, you know, really being there for the kids in many of their most vulnerable moment, right? Daniel, I want to switch that question to you. One of the things we know is that we can only provide those sports for kids when our staff are well. And so I want to have you talk a little bit just to how your organization has supported, staff wellness when we're talking about healthy minds and bodies.
Thanks, Becky. Love that question. And, I would say that the number one thing I did trainings on last year was on stress management, self-care, supporting out of school time staff through all of these challenges. How can they fill their cup so that they can then fill the cup of others? I would say movement and mindfulness have been two key areas of a lot of resources that we've shared, just integrating physical activity into programming time, building it into a schedule, just encouraging staff to take that little bit of time for themselves. Carlos calls it permission to pause. And Carlos, you should talk about that event because I think it's a great framework. So encouraging staff to just take some time, go for a walk, and recognize that movement in their day is really a key input to the outcome and impacts that they're going to have. And then, of course, mindfulness to encourage staff to take time, take a breather, step away from the computer, do some deep breathing, go out in nature, and take a break. I would say the nature mindfulness connection has been huge this past year as well. I'll put a link in the chat box to a webinar we did a couple weeks ago with the National Girls Collaborative Project on stress, mental health, and nature, and how the two are intertwined, and even ideas for kind of baking those concepts into STEM learning. So movement and mindfulness and a little bit of nature. And Carlos, you should speak to that permission to pause series, because I think that's a great model that other folks might be interested in following.
Sure. Yeah. For the sake of time, I'll drop it in the chat in terms of the one-page overview. But the term was actually coined by a colleague of ours out of Reebok. Box is the physical fitness curriculum, and we stole that and used that for the title of our workshop. And it was really about creating a self-care series that began a week ago. It'll continue at the end of this month, and it'll continue throughout the second semester. That is frontline facing. And I think the challenge and the challenge I put out to our field leaders and org leaders is to find space and time for our frontline staff to find the time to pause, because it is that group that can often carry the guilt of saying, I don't want to give time to myself because I've got 20 students, 50 students, 100 students that need me. But to Danielle's point, you've got to fill their cups, right? So I'll put it in the chat for y'all to see, just to save time. But thanks, Danielle, for that reference.
Carlos, that reminds me of a quote my dean here, and I'm in the College of Social Work at Ohio State, and he always says, slow down to speed up. And so sometimes to speed up and serve more kids and help more in the community, you yourself have to slow down a little. So I wanted to address a question we had in the chat box that kind of goes along with one of our planned questions for the panel. What resources are out there or that you're aware of that will help folks really think about how to transition physical fitness during the pandemic? Or what resources did you need or utilize when you pivoted programming?
Yeah, I mean, I'll throw in a couple. I think the box provided that fitness curriculum that we needed. We did find that fitness curriculum was probably the most challenging one to find for our organization. So it was nice to see this comprehensive approach that Reebok and Box crew had created. So I'll add that to the chat. For common threads, they had World Cuisine, which was a really kind of project-based way to look at food prep. So it's not just about making a meal, but it's also to understand the culture and the global aspect of creating a meal. So the World Cuisine curriculum was really, really awesome. So those are two that I can think of off the bat.
I would just add, think about engaging young people in the conversation as well. I'll put a link in the chat box. We developed a couple resources for doing a vision board activity with students. And there's another resource around creating family agreements. And I think that agreement exercise could be used outside of the caregiver family setting as well. So as you think about adapting physical activity, engage young, follow the CDC guidelines, but engage young people in that visioning process as well. There's been some great examples about the pool noodles and hula hoops, but I imagine if you pose that question to your students, they'll have some exciting ideas as well. So I'll put that link to those two resources, the family agreements and the vision board, in the chat box.
Awesome. Thank you, Daniel.
I was gonna say, I second Daniel too. I think going to the kids you serve and asking them and getting their input, also like not only great ideas, but really out of the box ideas too, which are just really fun sometimes, but also super useful. So yeah, I would definitely start who you're serving or supporting. Kind of another thing that I was thinking of that we really use that is outside of the scope a little bit of physical activity, but just in general when thinking about programming for the summers, we really took a look at resources that would help support reentry into the in-person space following COVID, and just thinking about creating a space as kids adjust to new routines. Maybe this is their first time back in person. Maybe they were virtually schooling this whole time, or maybe, they just, how to set expectations and kind of feel safe. Like what are the new norms for normal, and how do you set that up in this space? How do you do it in a kid-friendly way, right? So that it's not off-putting, or that kids feel it's fun, so, with us, one of our key things is star power, right? Activate your star power, which is like what makes you unique and special. And so we created like a star power safe bubble, and it's like just a way to make it kid friendly, but keep safe distancing. So I think, thinking about some of the resources that we looked at, this is not a specific resource, but Learning for Justice, which formerly Teaching for Tolerance, has a lot of great resource roundups on like creating a trauma sensitive space or things to consider with reentry, especially given different kids' experiences at home, right, and avoiding assumptions about that. And then also traumasensitiveschools.org. They have a lot of great stuff about just things to keep in mind when you're designing that programming space and equipping coaches. So.
Thank you. I will say one of the things that we'll add is don't be afraid to go to your local sport organizations. So many of our sport organizations have now been trying to operate for a year. And so there are great resources. When we looked at team sports, we really looked at like US Soccer has put out ways, they've created whole guides now on how to just do soccer individually. And soccer is one I'm familiar with, but I'm sure basketball and football have all started doing that because at the local level, they really wanted to get those leagues operating again. So it really looked at how to take team-based sport. The nice thing is you can really focus on individual sport with kiddos. So even though a sport might be team-based like basketball, dribbling is an individual skill. So you can kind of break those into individual skills for kids and still practice those. And I heard in the earlier panel too, outdoors is great. So if you have access to outdoor courts or you have access to outdoor facilities, what are some sports that were maybe traditionally inside that you could move to an outside, like a basketball? So we maybe have indoor court, but could you also find an outdoor court in your community? Along those lines, I want to talk a little bit about what did you learn in 2020 that you would say to another practitioner, don't do this in 2021, or hey, we want to do this differently. I think those are some of our best shared moments are, I made this mistake, don't make it too. Do you have anything that you would say to another practitioner, especially if you're looking at going in person or if you're offering virtual for another year in a row? What are some of those learnings that you would share?
Yeah, I'm happy to add something. So a lot of reasons I appreciate Carlos Santini, but I really appreciate that you led off with nutrition services. So I think one thing that I would encourage folks to do is lead with a whole child mindset and kind of think about physical activity, social emotional climate, nutrition services, family engagement. Think about all those pieces that wrap around keeping a young person at the center. I'll put into the chat box, there's a really great one-pager from CDC that talks about how out of school time can support whole child. And if you're looking to connect and create greater linkages to your school and the work that they do around comprehensive children's health, that's a really good tool to check out.
I'm writing this down myself. I love the idea of really thinking about that whole child from all these aspects of wellness, not just one particular area. Katie or Carlos, what about you? Lessons learned?
Ooh, I got a good one. I'm still learning it today, which is as leadership, be intentional about building in staff PD and self-care as you build your crisis response. Because what we did was we did it as a reactive element to the burnout and the struggles that our staff were facing. So it's almost like, you know, when they say by the time you're really thirsty, you're already too late in terms of drinking water, right? You should be drinking throughout so that you don't get into an extreme element of just kind of a dehydration. I would say the same thing with staff. Don't wait until they're dehydrated for them to drink water. And so build in an approach to help staff cope with such an extreme transition in how we offer services. You know, what I noticed about myself was, and I look back at the year and I go, okay, I was at home, I had a park near me, I could step out and walk, but I never did those things. Like I just stayed glued to my desk. And so what's that about? Why did I behave that way? And I think there is this element of sacrifice that our staff put in that becomes unhealthy. So as leadership, it's our job to pay attention to that and get ahead of it and know that that's how our people are going to respond. So be proactive and build a component where, to your point, Becky, right? Slow down so that we could do better work as opposed to rushing through it all and feeling like we accomplished something and sacrificed a lot, only to look back and go, oh, we really beat ourselves up, you know? So that's one thing that I learned the hard way. I'd say that. I actually would add one more thing, connection before content, right? And so we launched a series of skill-based academies, and we just, you know, we launched our Cartoon Academy last Friday, and we put a lot of amazing time into our curriculum. We felt it was like on point, and it is. But as we were delivering it, we were more focused on delivering the content rather than pausing to connect and ensure that that learning was sticking and that kids' voices were showing up. We were more concerned with getting out the content and getting kids excited about the content and the history of cartooning rather than pausing to hear their voice and engage them in conversations with each other. So we also learned, especially in a remote environment, that just throwing content through the screen is really detrimental. It's best to slow down content, ensure connection, and even better yet, connect ahead of the content delivery. That's another lesson that we learned.
Carlos, I just want to add on to that. So I would underline that like 10 times, slowing down. I mean, so much so in many of the healthier generation workshops that I've been a part of, we're practicing and doing the activities together. So like one slide in a presentation is about a do-it-yourself infused water challenge. And so it's like, pick which of these ingredients would you like to put in water, and why is it important to try infused water? How might you introduce this to students? So rather than talking about that, we actually play the game and devote the time and be really intentional about creating the space so that folks can talk about how they might adapt that, or if they were in person, hybrid, or virtual. So agree, absolutely.
I think that's very important when we talk about, I think even in this Zoom setting, when you're talking about building relationships with kids, and potentially some of us will still be virtual this summer, there's this need to fill the silence even more than in person, right? And sometimes in the silence is where those important conversations come with kids and where we have those social interactions that are really about building relationships that we know is so important for kids. And so I love that you really talked about that connection before content. Katie, did you have something to add as well?
Well, no, I was just gonna triple that. I think maybe we all learned this, especially in the virtual space, right? But and we're in the world of physical activity and social emotional learning. So we're like, oh, especially now, right? We need to get across like caring and compassion and like building resilience. But also we learned we just need to like kind of step back and just let you know, what did the kids want at that time? Like they just wanted to talk, like they wanted to connect, they wanted to play games together, they wanted to hear what they had in common, what were you doing today, you know, like when we left space, that's when we saw like the curriculum come to life, because now there's human connection there, right? Like now this coach sees me and I see my teammates, and that I think, yeah, can't be underlined, as Daniel said, enough. I think that with this urgency to get out this really important content, we miss the whole kid right in front of us, right? Which is the whole point. So I think no matter what you do this summer, even if it's like the simplest thing, if a kid gets to experience that with like other kids, that's huge, you know, like that's big, like that's important. So I feel like just taking some of the pressure off of yourself and not feeling like, you know, not only do I have to program in COVID with all these restrictions, like if you create that space, like kids are excited to be there. Like, I don't know, take hope in that. And then the other thing I was just gonna say is like sit in each of the shoes of the people, of your stakeholders. Like I think one thing we did was we focused really on like the participant experience and somewhat to the detriment of our coaches, right? Like then, you know, when it came back that the coaches were like having to use 3 different materials to get through a lesson, or like the physical adaptations were over here and it was just cumbersome to them. Like think really seamlessly about how you can make each person interacting in that program, how you can make their work as easy as possible, and just like think through that lens. How's their experience going to be? Because I think when we did that, we were able to create some really useful resources for our coaches that were much more supportive when we took on their lens. So just another thought.
So I actually have a couple questions coming in from the audience, and so the first is, I think, a more simple one. Where can we find the world cuisine curriculum? I'm
putting it over there soon.
Okay, so Carlos, when you find that, you can share that. And then the second one is, does anyone have any great ideas to encourage healthy competition between kids? We have had an increasing number of children who are poor sports or who demonstrate tantrums when not winning.
I'm going to jump in here, and I maybe to reframe this a bit, just because we're kind of, Girls on the Run is a non-competitive organization, explicitly, but I think it's a good question, right? It's like, because we have kids who get upset when they don't win. It's like, so rather than making a competitive sport, maybe the question is, just putting this out there, are there like other things you can do before it gets to that point, So I don't know, here's one idea, but is like fostering a mastery climate where you focus on individual effort, praising the kid for what they did do well in that competition. And I know that's like, okay, but you watch this relay race and see who the kid loses, and then you tell him, he ran great. But I think, building that language into how coaches are trained makes a big difference. Helping kids like set individual goals and focus on that. Like, here's what you did well, like you rocked. Like, this is a, personal, like PR, like let's focus on personal, what's your personal record? What's your best, rather than comparison. I think that kind of, I don't know, maybe that's going around the problem, but it's another way to kind of think about it, is how can you set it up so it's not about winning or losing, but your personal best.
Yeah, I would add to that, Katie. One of the things we've, learned at Life Sports, we play, again, a lot of like team sports that tend to be competitive in nature, is really focusing on the individual skill building of the kids, and then also your staff modeling. So if your staff model that it's so much more important about you getting better or us getting better as a group and a team, and less focus on the win. And so I think by nature, especially for us in sport-based programs, when you come from the environment, you're hiring your staff, right, or former athletes themselves. A lot of times their mind shifts of, well, this is to win this summer. And so I always joke to my staff that I have extra gold medals in my office. And that if winning the gold medal at the end of our competition is life or death for them, please find me after camp and I will give them a gold medal. But not to make our kids ever feel like that is the end, right? That the goal is that they had fun. And also to infuse that throughout your program, right? It can't just be this like stop having competition or we don't want to have compete, or we want to be a good sport right now, but how do you embrace sportsmanship the entire duration of your program, not in these just small instances? Carlos, I saw you pipe up as well with some.
Yeah, no, I just wanted to just really thank, and to your point, Becky, thank Katarina for what she's recommending. And I love Michael Turley's recommendations here. Find win-win games, collaboration. And that reminded me, like in the late, I don't know if it was in the late 90s, early 2000s, they had this thing called modified rules sports, I think, where you modify the rules of play so it wasn't competitive, but collaborative. For example, as opposed to winning the point in tennis, you would try and get the longest rally, because that really just kind of demonstrated collaboration. So I think that is spot on. I'm going to read verbatim here what my colleagues from South Florida wrote. They said, we created a growing guide activity book that focused on skill building activities and drill competitions. This provided a way for students to improve coordination and sport-specific skills, as well in replacement of competition. So this idea of, to your point, Katarina, improving your own personal skill set rather than beating your opponent is something that that stood out in this response from our people in South Florida.
Exactly. So I guess as we wrap up here, we just have a few minutes left. And so I think the last question I'd like to pose to the panel is, in the midst of so much uncertainty, and I know we're moving into another summer that is looking brighter, right? But we still, I think all of us are sitting still on a little, have some anxiety in the back, right? Of what the summer will look like. Can you share a story of reflection that gives you hope?
Yeah, I'm happy to share a story. This is a story from Wilson, Ohio. It was one of our family engagement and distinction winners from our America's Healthiest Schools work. So it was a school, and they put together a virtual meditation center with resources on trauma-informed care, resources on yoga activities that families could do, meditation activities. And then on Friday, their staff would lead virtual family field trips around the world. And they also, you'll see there's a really key social emotional health lens that they took on this. They also did care calls, those kind of like wellness checks, Carlos, to grandparents that served as the primary caregivers. So I really liked that one, just community kind of coming together, thinking through how they can support intergenerational families and the challenges that they were experiencing.
Thank you, Daniel. Two stories, one short, one a little longer, which is we had a songwriting academy that took place over the summer of 2020. And we had, it was a small group, 14 students. It was a very small kind of test, beta program. And there was one student who just didn't share a lot. But he would come every week and he would work on his lyrics. He would never really share them. His mentor would share it on his behalf. And towards the end of the academy, when we were basically saying goodbye, and literally as we struck the final minute, he unmutes himself and he says, "This has really been a family for me, right? This has really been a family for me." So all along, you're thinking, are we getting to him? Does this do it for him? Does he feel engaged? Does he feel included? And all along, he was just observing and taking in that. And so it's cool to hear him say that at the end. And the other is out of our New York chapter, we had, it was called the Smart, Funny, and Black event, which was a night celebrating Black excellence. And it was really an open mic night. It was a night to share talent. Over 70 families logged on to participate. And it was the first family-centered event around the voice of the Black community in our programs. And so it was great to see that level of celebration and engagement from our families. So, despite the unrest and the challenges of racial equity, social justice, at the end of that dark time for us this past year, we see this idea of hope and families still celebrating their culture, still celebrating their own Black lives, despite, right, some of the challenges that we went through as a nation. So that was really inspiring.
Both wonderful stories. I always love, there's always the one quiet kid, right, who you just realize is giving so much. And when they finally speak, it like moves mountains usually.
Yeah, I was just going to say both, all great stories, such great stories. Yeah, the story that kind of we, came back to or was really helpful, especially being kind of removed from on the ground programming. When we put together our virtual programming, a lot of our fear was it's just not going to be the same. It's just not going to be the same. It's not going to have that same like go-to magic, and, can you really do it? Can you really like transition something like that and have that community experience and that momentum and everything? And we heard from this one family, they sent us an email. They moved right in the middle of the pandemic. So their daughter had to start at a new school, not knowing anyone. And they said that, we moved in the middle of the pandemic. We were in completely virtual schooling. And like on a whim, we joined, Go to Virtual. And it was like a game changer. Like she made friends and she described it as like a lifeline for her tween. So for us, like, that's it, that's like, that's the win. So that was just really cool to see, like, for this kid, if we didn't have, if we didn't make that transition or maybe, have to make those hard decisions about making it virtual and it's not perfect, it's different, but maybe they would not have had that connection, right? And so to just come through, especially in a pandemic, it was just really cool to hear that. So
I love that. One of the things our staff here locally joked about at the end of summer was that virtual camp has a lot of the same components as in-person camp, right? We kind of joked that relationships still mattered. And I heard a lot of that through talk today, like relationships still matter and finding the time to connect personally with the kids about things that are going on in their lives are so critical. We joke that we still misplaced a kid here or there, right? The kid got on the wrong Zoom link. And usually it's the wrong bus at our camp, but they still got on the wrong Zoom link. And then we also just talked about for us what a blessing it was to be involved in our parents' lives and see our parents more. We bus our kids. And so virtual really allowed us to see some of our kids' home lives that maybe we don't get to see as much, and also got our parents engaged in some of our programming in ways that were different. So I just loved hearing from all of you. And I want to thank you so much for joining us today on the panel. I know Leslie has put, I think, everybody's contact information and organization website in the chat. But if anyone wants to reach our panelists later, please do so. Wonderful individuals and great programs. And I'm going to switch back and pass us back to Aaron now.
Okay. Well, thank you so much, Becky and Katerina and Daniel and Carlos. You guys did amazing work sharing resources and experiences. And again, humility. We all learn more from our mistakes often than what works well. And I appreciate us having a safe space and community where we could just talk about this, because as we learn from mistakes, we'll make better experiences for our staff and for our young people. I heard so many great lessons. And this was also a great session piggybacking on what we just heard from our friends and partners in the American Camp Association. And at the highest level, for everyone who's still with us today, I am taking a lot of inspiration. My cup is getting filled up because I see so many great groups who are thinking beyond themselves and sharing. And, we all, like you said, Carlos, we could divvy ourselves up in different ways. But at the end of the day, when we're putting the 29 million students in America, kindergarten through 12th grade, who qualify for the free reduced lunch program, and as we look at that, serving their needs and their families' needs as our collective goal, and then we just realize it just takes all of us. And none of us can serve all of them by ourselves, and we need all of us together. And so the challenge I'll leave everyone with on this call is to now, I encourage you, it's March 2nd, as Martin Luther King and then President Barack Obama talked about, there's a fierce urgency of now, but at the same time, we need to slow down. So again, we have some time to plan properly and with intention. And we have some time to be proactive and reach across our organizations and sectors even, and build some partnerships. So I want to encourage everyone, think about who you're going to call next week at a school district, at another nonprofit, a corporate sector who's going to help you make your program better. And what is that partnership that you're going to do? Our pledge, again, is to help cultivate those partnerships, keep giving you resources, keep lobbying for more dollars so you have the money to do everything you need. And that's going to be coming up. I also just want to, highlight a couple things for tomorrow. So again, tomorrow we have our day 3. I think it's going to be an amazing day. We have phenomenal speakers. The Mott Foundation is going to be our title sponsor. It's also being co-presented by the National After School Association and the wonderful group Every Hour Counts, who are support intermediaries in cities across our country in the out of school time world. And we're going to be talking about 2 major things tomorrow. One is scenario planning, and you're going to hear from real nationally acclaimed leaders who are going to be talking about, all right, it still could be virtual, could be hybrid, could be in person. How do you prepare for all of those? And there's going to be some tools and resources you're going to hear about and get to use. And then the second part is about multi-sector partnerships. And again, it's not serving all the needs of young people in America is not only on school districts, it's not only on nonprofits and after school, it's not only in the corporate sector, but the people, when you say go for the win, it's the leaders from every sector who know how to connect those dots and bring all those resources together in a comprehensive way to support our young people. So we're going to be talking about that. You're going to hear from great people who we think are doing that really well. And they're going to be sharing resources. And then we have this bonus session that I need to really plug because we're going to have 2 US senators who are making time to talk about our issues and talking about how do we get more federal investment into summer and after school and community school district partnerships. So that's tomorrow at 3. There might be a separate link for that, but we're going to shoot that out to everyone. We really do hope you come because a bigger turnout sends a message that, hey, they're advocating for billions of dollars for our field. It'd be good if our field was there to show support, that we appreciate that effort. And it may not happen, it may happen, but this is an ongoing lesson. And one of the things, our hopes, is that the investment and attention that this summer and next summer are getting are not just kind of fly by night. We're trying to set up an American education system that still sees summer as distinct and unique and a great experience, but still worth real government investment, because that's the only way things go to scale. So, we're going to talk more about that tomorrow. Again, great resources will be available, great speakers from Jennifer Peck, from Partnership for Children to Chris Smith, from Boston After School and Beyond, Gina Warner from the National After School Association, Dawn Hill, who runs the City of Charlotte Youth Employment Program. So there's more. You're going to hear from all of them. The Pittsburgh School District will be on as well, sharing some of their great experiences. I love this idea of connection before content. I just want to underscore that we're all ultimately in the relationship business. And that is what drives our success and what drives young people feeling heard and connected and attending. So that is really important. And then just a little preview of day 4, we will be focused much more on social emotional learning specifically, which we definitely talked about today a lot. And then we'll also be talking about culturally responsive and relevant curriculum. And we still should acknowledge we don't work and live in a vacuum. The issues of racial and social injustice continue to be major issues that this country needs to contend with. And all of us want to work so fast, and we want to support academics and want to support health. But again, there's real trauma, there's real challenges from COVID. A lot of people have been affected, but communities of color much more so. And we want to take that into context and consideration as we're designing programs and meet everyone's full needs. So this is what we're doing. We're doing it this week because there's the fierce urgency of now. We want to reach as many millions of young people and families the way they want for this coming summer. And the people that have been on this call, all of us together, we can achieve that. So I cannot thank you all enough. Thank you, Becky, for moderating a great panel. Thank you to Tom and our ACA panelists on the earlier session. We hope everyone will join us tomorrow. Please take care of yourselves as you need. How are you? Make sure you are asking yourselves that question. Make sure you're asking your peers that question. But we together will have an amazing summer ahead of us. So thank you for joining today. We look forward to seeing you tomorrow as well. 1 o'clock. Thank you, everyone.
Thank you, Aaron. Thanks, everyone. Have a great day out there.